Today we have with us Dr. Lindsey Ricciardi. She is a licensed clinical psychologist, and she specializes in eating and weight disorders. I'm very excited to have her here with us and for her to share her time and her expertise. I've been practicing here in Las Vegas for 10 years, and very, very often we are just at a loss with who to send our children to who are suffering with eating disorders. Now, her expertise is going to be across the age span, so she'll talk with us a bit about the young as well as the middle folks who are in their middle earlies, as well as our seniors, and how that plays out. She completed her PhD at UNLV, so she's homegrown. She's one of our own. That's exciting. I'm not even one of our own. I'm just a wannabe here in Las Vegas. But she's graduated out of UNLV. I'm sure they're very proud to have had her come from our program here. She did an internship and a fellowship at the University of Chicago, Eating and Weight Disorders Clinic, I suspect. Let me see, Director of Behavioral Health Services at Creative Health Solutions, and she worked in an interdisciplinary wellness and weight loss clinic that really pulled together psychology, primary care, and bariatrics. Boy, that's a big word. We'll have her break that one down for us. Her partner, her business partner and life partner, is a board-certified internist with a specialty in bariatric medicine. So I understand that I have every intention of inviting Dr. Ricciardi back with us, and she's going to bring her husband with her next time. She's been the author of several peer-reviewed articles and co-author of a book about the psychological and social impact of obesity surgery. So welcome.
Thank you.
Can we call you Lindsey with all those fancy letters behind your name?
Absolutely.
Oh, thank you. Lindsey, where do you want to start? You've got research to tell us about. You know what? Let me have you break down that big word for us.
Okay, bariatrics.
Please.
And you'll hear that word come up a lot. And first of all, people often ask if I deal with seniors because it sounds so much like geriatrics, but it's not. Bariatrics basically means weight loss, and a lot of times we hear it associated with weight loss surgery, but it also encompasses the behavioral and the psychological aspects of weight loss as well. And that's what I'm currently doing, is the non-surgical part of weight loss. So whenever you hear that word bariatrics, now everybody knows it comes from baros, the Greek word for weight loss.
Oh, is that for, okay, baros, the Greek
weight,
word.
I believe, weight.
Okay, Greek word for weight. So, and starting with the B as in boy, as opposed to the geriatrics, right, where folks are getting it mixed up. So you've done some research in this field, and you're a co-author on a book as well. So you have lots to share with us.
Well, I became interested in the psychosocial aspects of weight loss surgery in 1999. And interestingly, that was before weight loss surgery really boomed the way it has in recent years. In the year that I started researching the outcomes of surgery, approximately 30,000 surgeries were performed, and as of 2006, there were close to 200,000 surgeries performed. And
is this? Are we being vain? Is that coming back around to just physical beauty again, or I mean, because there's a very significant, very real health component when you're talking about obesity.
That's a great question, and I will tell you that in all of the years of doing this, very rarely does vanity come up as a motivation, or even just wanting to look better. Usually the most common reason cited is that people want to be healthier, they want to be physically active, they want to increase their mobility, they want to live to see their children grow up and get married and have children. Most of the reasons cited are quality of life. Of course, there's that component of wanting to be able to shop in a regular store, which so often people, by the time they've gotten to the point where they're looking at surgery, that they've gotten to the point where they're considered severely obese, and it's very difficult to shop and find clothing that fits, even shoes that fit appropriately. So one of the exciting things for many people is to be able to shop in a regular store again and to look nice and or feel good in their bodies. And interestingly, people have the surgery and you see this total transformation sometimes with they start to have fun shopping again. They want to get their hair cut. They really start putting a lot more emphasis on their appearance because they feel more proud of themselves and they have a greater sense of self-esteem.
It sounds like really we're going to focus on the obesity aspects of eating disorders because there's bulimia.
Yep.
There's anorexia nervosa, which would be the restriction of food intake. And those pieces, are we going to set them aside? Are we going to focus in on?
I think probably for today's talk we can do that, but it's probably important to note that there is a lot of disordered eating when we're talking about obesity, because people have typically been on one diet or another their entire life. So I see a lot of binge eating. I hear about people who restricted severely as adolescents and because they were overweight. But interestingly, the way the classification works now, they don't meet criteria for an eating disorder per se if they drop 50 pounds in 3 months. Everybody thinks, oh, you look great because you're not overweight anymore. So
what would you do as an expert with as an expert in eating disorders? 50-pound weight loss in 3 months, what do you think?
Way too fast, way too drastic, very high likelihood of regaining that weight back.
Is it medically dangerous?
It can be. If people are going to be losing a lot of weight very quickly, both my husband and I would highly recommend that they have medical supervision, especially if they're on medications for high blood pressure, their diabetes. That medication needs to be monitored. But so it can be dangerous medically, but more so I think the effects of that are dangerous psychologically. People lose a lot of weight in a very short time, and as soon as they return to some semblance of a normal lifestyle or what was normal to them, all of that weight will typically come back on, and then some. And that can be incredibly demoralizing for people, especially teens. And so, I know a lot of your focus with the show is on families, and the families struggle with what to do with loved ones, especially adolescents who are overweight, and that's certainly something that we can talk about, and how to find the balance between having them restrict severely and have a very dysfunctional relationship with food, between that and continuing in their own ways currently and staying at that same weight. So really trying to find a middle ground.
Excellent. That I think we'll be very happy, very interested in hearing about what do we do as parents if it's our children, and then the aspect of what do we do if it's us, and what do we do if it's just a loved one in an adult-to-adult relationship. How would we support someone who's going to pursue bariatric, intervention? You said psychologically there's some very severe psychological components, very relevant psychological components to obesity. How do you measure it? What are you going to do, being the expert that you are? Someone comes into your practice, and how do you go about working them up?
Well, right now my practice is primarily, like I said, the behavioral and the medical aspects, and the big things that we're looking at are quality of life. It's a very general term, and I'll describe what that means, but your day-to-day interactions, activities, are you able to do things that you enjoy doing, like walking through the park, playing with your kids? How's your mood generally? And so I have certain assessment tools for mood and body image. How do you feel about your body, self-esteem? Those are the